to CIMS, Calcutta Institute of Maxillofacial Surgery. Today we were going to talk about everything that you need to know about dental implants. We have gathered all the questions that came in our website at different times and we'll answer them one by one. First question is, what is a dental implant? It is not just a screw in the jawbone which holds a tooth on top. It is an artificial substitute of a natural tooth, and it works almost exactly like a natural tooth. It is not really a screw. It is a cylinder. I will just give you an impression of it. So what is called as a screw is actually a cylinder, as we mentioned. So this is the screw, and there is another tube inside, which again has got its threads inside there. Now this thing goes all the way into the jawbone. See, this is the jawbone, and it gets united with the bone. This is a very special quality of the metal called titanium. It is very biocompatible and it happily stays inside bone, and the surface, the outer surface, is treated in a special way where there are micro corrugation, there are micro gaps and dents and holes on the surface, which under electron microscopic view can look like a real surface of the moon, where through these into these holes, osteoblasts, which are bone cells, they grow in freely and deposit bone over there. This bone then firmly holds the implant back. This process is called osseointegration. It takes some time after the screw is placed. So initially the screw is held in position mechanically, like a screw that you put into a wooden block. That is a mechanical lock. But eventually it becomes an integral part of the bone due to the ingrowth of bone into those micro crevices that are there due to the surface treatment of titanium. Now once that happens, comes the next stage. Initially we place the implant, let it be there, and it gets osseointegrated. At that time there is something called a cover screw that kind of locks that hole, that pipe, so that food debris and bacteria cannot grow inside. After a finite time of osseointegration, that bit, this screw is taken out, and it is again a cylinder. At this stage we have got something called an abutment, which is a second piece. That has got threads which matches the threads inside that cylinder, and this second screw is not a part of the abutment. It is a third element. So the abutment is a piece of metal which has got a collar that goes inside the implant, and this third element, which is the coupling screw, that holds the abutment tightly secured to the implant, which is also called the fixture. Actually, these terminologies are pretty complicated, and that's not for somebody who is not a dental student, so I will not go in depth with the terminologies. So this is the fixture, into which there is this cylinder, into which this coupling screw holds the abutment firmly fixed. The tighter this coupling screw goes, the more firmly the abutment gets fixed to the fixture. Finally, there is a crown like a simple dental crown. There is a crown which is fabricated and placed on top of the abutment. So that whole construction altogether is called an implant. It is very rigid, actually more rigid than your normal tooth, and if it is kept in health, then it will stay with you, and the top will look like and function like a natural tooth. Now we all know that this is not the only form of fixed replacement of a lost tooth. The more common one over a long period of time, I'm just rubbing this off, the more common one over a long period of time was the bridge, where one or more lost teeth are replaced by tooth-like structures. So that's a tooth-like structure, not a tooth, because these two have got no root. There is gum below it, and on the two sides, the neighboring structures are teeth. And they are cut into in a specific shape so that they can hold a metal crown which is soldered together with the false teeth. So this is a bridge. This is a bridge. Two tooth-like structures soldered to two crowns which are supported by two normal teeth. The question that was asked to me was, is an implant better than a bridge? I would say the circumstance will decide that. If we had two decayed teeth and there was one space missing, then the bridge would be good enough, because these decayed teeth might need root canal treatment and a crown anyway. However, if these were healthy teeth, then we are cutting off the enamel from healthy teeth, so actually killing them, and then replacing the lost teeth with two tooth-like structures. If that is the case, okay, we have got two good teeth killed. Killed means they become weaker also. But okay, if we can take that, then is that good enough? A good substitute of implant? I would say sometimes yes, but not always. Because any dental student knows that the bridge stays in position, remains strong, and the neighboring teeth, which are the abutments, they remain good on the basis of a law called the Antes law. Now this Antes law states that the surface area of the roots of the teeth to be replaced must be less than or equal to the surface area of the roots of the abutments. Now if these teeth had roots, they would be something like this. Now from common sense you can very easily see that this plus this is much less than these. So when you see long bridges, long span bridges made on the strength of two teeth which are narrow rooted, which is very common. People lose the molar teeth first most often, and they are replaced by a bridge with a 8 which has got a weak root and another premolar. So what happens is the total surface area of the roots to be replaced is actually much more than the surface area of the teeth which are holding the bridge together. So this is a bridge on the river Kwai. Why? If you remember the movie, you would know that the bridge was built to be destroyed. From day one, when the bridge was being built, it was known that this bridge is going to be destroyed. Just like that, a dentist who does this kind of a bridge knows from the very beginning that this bridge is not going to last for long, and when it goes, it will go with the abutments as well, because they have had to do much more than they were supposed to do in terms of holding strength. So most commonly, it is a good statement, it is a fair statement to say that an implant is generally a much better replacement of a tooth than a bridge. Now then the next question was, how long does implant rehabilitation take? You have to understand that different implant rehabilitations take different amount of time, but in general it is about 10 minutes, 15 minutes to place the implant, which is the fixture. I will tell you the standard procedure. We leave it for about 3 to maximum 4 months for osseointegration, and at the end of osseointegration there are about 2 sittings in which the abutment is seated, impression registered, and the crown is prepared in the lab. The impression is sent to the lab for the fabrication of crown. When it comes back, it is placed on the tooth. So it is day 1 or day 0, 3 months, 3 months and 7 days, and you get a brand new tooth kind of coming out from your jaw like a normal tooth. However, today there are immediate substitutions. That is, we can actually place an implant immediately after an extraction. Circumstances are special, and it can be loaded immediately as well, with initially with a temporary bridge and later on with a final bridge or a crown. These are quite successful if the initial placement torque, that means how hard we can turn the implant, the screw, into the bone. If it is beyond a certain Newton of force, then it is accepted. Scientifically, it is considered to be safe to load it immediately. However, we are kind of a bit old school, and we believe in something that we have seen over years and years, and we still practice the 2-stage implants much more. That is, day 0, about 3 months, and final stage. Next was, how much pain is involved in an implant and how many times? The total pain is in day 1, which is 1 or 2 local anesthetic injections that you can understand, and that is it. You are not supposed to feel any additional pain after that. Following the day of placement, for about 48 hours, about 50% of patients require a day or 2 of painkillers, maybe 3 days, but that's all. And I have many of my patients coming and telling me that doctor, you wrote those painkillers, but I didn't need any. So implant is much less painful a procedure than a simple tooth extraction. Stage 2, is there pain? Usually it can be done under a spray anesthesia, so even injection can be avoided, and we just expose the top, take out the cover screw, and go for the abutment placement. Can a fully edentulous patient get implant rehabilitation? Interesting question, and the answer is very much yes. A fully edentulous patient can have an implant rehabilitation in 2 ways. One is an implant bridge, which is a fixed set of teeth. For that, if it is standard implants, then you require about 6 implants for about 14 teeth. I must mention here that normally we do not replace 32 teeth, we replace only 28, up to 7 on each side, because the third molars are vestigial organs and they do not need to be replaced after they are gone. So about 28 teeth can be held by about 6 implants strategically placed. There are ways to put the full set of bridge in less than 6. There is something called all on 4. 4 implants can hold the whole bridge, both in upper and lower jaw, if other bone conditions are favorable. There is another beautiful system that has come up now and which we regularly use when the bone is inadequate. For the upper jaw, we use something called zygomatic implant. So I will just give a spread diagram So these are the eye sockets. That's the nose, a picture you are all quite used to. And that is called the zygomatic arch. Now this is the ridge or the area on which the teeth exist. That's the nose. So under normal circumstances, there will be implants placed here to hold the bridge. But what often happens, now we must understand that there is something called a sinus in this area. This is called sinus. This is a hollow area, and an implant, if it enters into the sinus, that's a problem. So that's the sinus, that's the upper jaw, and our big problem is often a ridge which is very thin. If we lose a lot of bone, which starts happening as soon as we lose the teeth, the bone starts getting resolved. Now here, you see the situation becomes something like this. So we don't have enough bone to place an implant. In these circumstances, nowadays we do something called zygomatic implant. There is solid bone here and here. These two are zygomatic bones. From inside the zygomatic bone, we can have oblique implants coming out. We can have one, and sometimes we can have two zygomatic implants. They come out like that. The threads are here. The threads are here, engaging the zygoma bone, whereas the last cylinder, as you remember, there was a cylinder inside the implant. That cylinder is in this end, and these have got special tilted abutments. Those abutments come out into the mouth, and on the basis of these are much stronger implants than the standard implant. On the basis of these, we can have the full set of teeth placed somewhat like this. This is an oversimplification, but I think that is enough to make things clear how we place implants, zygomatic implants, and we hold the upper teeth, the whole upper arch, as a fixed substitution. What happens in the other case? I said there are two ways. This and the standard implants was one way. The other way is a hybrid denture, which is, say now I draw the lower jaw. That's the lower jaw. The lower denture is the problem denture. It kind of floats around. Upper denture is usually a bit more stable. We can place just two nice implants somewhere close to the central part. These are the two implants, and there are two small ball heads, or sometimes there is another one called locator. Some ball heads are placed on top of these implants. So that's the ball head abutment, and this is the cylinder that goes in, and it is locked. On top of these, we can have a female system which will be engaging these ball heads, and on top of that, yes, you guessed right, there will be the denture sitting, and there will be the teeth here. So that's the other type of implant supported full denture, which should be taken out at night, but throughout the day the person who is actually wearing it will sometimes forget that they are wearing dentures, because it is not going to be like the usual dentures which kind of tends to float around in the mouth. They will be firmly secured by these attachments. Next, can anybody and everybody get an implant in the place of a lost tooth? Well, yes, almost. Somebody who is medically reasonable can get an implant, and somebody who is medically unreasonable, I believe they have got other priorities in life rather than implants. So, talking about people who have got diabetes, yes, if we can keep the diabetes reasonably under control, implant is not a big deal. cardiac conditions, blood thinners. We have got ways of handling the circumstance at the time when we are placing the implant. There is one condition where we try to avoid implants: people who had radiation of their jaw for oral cancer. We try to avoid placing implants in them because there is a dreaded condition called osteoradionecrosis, which can happen in their jaws. Well, that can happen with or without implant placement. But we try to avoid them at all cost. So we tend to avoid placing implants in irradiated jaws. Local problems are lack of bone, and here I had shown how we can handle the lack of bone. The systemic problems, as we mentioned, are diabetes, mainly diabetes, which is a very common condition. About hypertensives, which is people with high blood pressure, they are not usually a problem. But diabetics, they are more prone to getting infection, and failures due to infection is marginally higher possibility in a diabetic. But if we think that otherwise things are fine, we would go for an implant without thinking a lot. There is another situation. I would personally sometimes not offer implant to people who have been very cruel to their own teeth. If the teeth have been lost due to gum disease of a kind which could have been avoided, then we would think many times before offering them implants. Because the problem is, when you lose your own teeth, you don't complain much. First of all, you know that you are to be blamed. And secondly, and more importantly, is because it came for free. Now when I take money and place an implant and you make it fail, you never think that you did it. So those are sometimes people whom implant is not offered easily to. So as cost already came in, the next very important question is, what is the cost of an implant rehabilitation? To start with, I will give you the cost that we offer usually for almost all types of implants apart from two and apart from zygomatic implants. Zygomatic implant is very different. We are not talking about their cost now. Standard implant costs 20,000 for the fixture and roughly up to 10,000 for the superstructure part tooth. So it is coming up to about 30,000 over a period of 3.5 months. Now there are two, I will not use the brand names. You will all know if you search a little. The first and the second companies in the world, both Swiss, actually one was a student of the other. When they launched their implants, it was obnoxiously extravagant, the procedure. It was considered to be something only limited to the absolute upper crust of the society. So those two implants are still the most expensive, and they cost just about double the cost that I told you for the standard implants. We're coming towards the end. Can a person who has an implant get CT or MRI? The answer is yes. They can happily get, well, forget CT. CT has never been a problem. It is an MRI about which people quite often ask. There has been no documentation of any problem happening due to good quality titanium implants placed in the jaw to replace teeth. Is an implant a lifetime guaranteed? Your own teeth are not lifetime guaranteed, neither are implants. But maintained well, an implant will last a lifetime usually. There are failures, like see, when I am crossing the road to come to place the implant in your jaw, I have got a risk of an accident on the road. Just like that, there are accidental circumstances in everything, but that is really, really low. And implants usually have got more than 90% success rate, and that is documented. So, well, implants are not lifetime guaranteed, but implants are often there for the lifetime. Can an implant be removed if needed? And what then? This is a very important question. Some people, because you see, there is a problem today, even today, implants and the facility of implant placement is not available as much as the availability of the facility of crown and bridge work. So, and the other thing is, to start an implant practice, the infrastructure cost is much higher than standard dental rehabilitations. So many people, many practitioners do not have the facility of implants and have got very limited exposure into implants. They sometimes kind of spread the message that okay, the implant goes in, but if it has to be taken out, there will be disaster. No disaster. I did have to take out a few implants sometimes, and implants do come out. If they are not well osseointegrated, they are very easy to come out. They actually try to fall off by themselves. That's a failing implant is actually the easiest thing to take out. And if the implant is healthy, why do we need to take them out? We don't. But even if a good implant, say for example there is screw breakage, there is some other form of a problem for which the implant needs to come out, there are ways to take that implant out, and a good maxillofacial surgeon can do that quite easily. Are there any serious side effects of implants? Well, if an implant is placed in the right way, in the right place where it should be, then the answer is no. There is no known special side effect of just an implant placement. Really, nothing that I can think of. And finally, is there any special maintenance required? To be very honest, there is no special maintenance required. But that is, if you are already maintaining your teeth perfectly well, it requires just as much maintenance is required for your own tooth. However, we provide a 5 years guarantee, a direct guarantee of replacement for free on implants if somebody gets the implants seen by us every 6 months. Cost about 1,000 rupees, 1,500 rupees for a special type of cleaning. Just like scaling in normal teeth, implants require plastic scaling, and that is just because tooth, being a living structure, has got its own defense mechanism, whereas implant is a foreign body which is placed inside your jaw. So it has got its limitation of not being able to provide a fight from inside. It hasn't got an immune system, it hasn't got a blood supply. So just because there is no fighting ability from inside, hardly whether it is required, we usually prefer to support them from outside, that is, keep the area clean and as bacteria free as possible. And I think in that we have covered all that one needs to know about an implant. We will still be available for any further questions, and you can shoot them at us on our website, which is kolkatamaxillofacial.com, and see you then till next time. Thank you.